Ethical issues and implications in communication research for allied healthcare professionals. Welcome. Today, we will delve into the ethical issues and implications in research surrounding communication within the allied healthcare profession. This presentation will cover principles of scientific communication, ethical implications in human research, communication issues during research, effective communication strategies with patients, families, and providers, and skills for formal correspondence. Principles of scientific communication is fundamental in advancing knowledge and practice in the allied healthcare field. The following principles are crucial: clarity and precision. Ensure that research findings are presented in a clear and precise manner to avoid misinterpretation. Transparency. Openly share methodology, data, and results for peer review and replication. Objectivity. Maintain neutrality and avoid bias in presenting research outcomes. Integrity. Uphold honesty and ethical standards, avoiding plagiarism and falsification of data. Ethical implications in human research. Conducting research involving human subjects in allied healthcare requires adherence to ethical principles that protect participants' rights and welfare. Key ethical implications include informed consent. Participants must be fully informed about the research purpose, procedures, risks, and benefits, and provide voluntary consent. Confidentiality. Researchers must safeguard participants' personal and medical information. Risk minimization. Efforts should be made to minimize physical, psychological, and emotional risks to participants. Autonomy. Respect participants' autonomy by allowing them to make decisions about their involvement. Communication issues in research. Effective communication is critical when conducting research in the allied healthcare field. Ethical issues around communication include miscommunication. Misinterpretation of research findings can lead to incorrect clinical practices. Disclosure. Ethical dilemmas may arise regarding the timing and extent of information shared with participants, especially if the findings are sensitive or unexpected. Power dynamics. Researchers must be aware of power imbalance between themselves and participants and strive to maintain an atmosphere of mutual respect and trust. Effective communication strategies. To communicate effectively and appropriately with patients, families, and healthcare providers, allied healthcare professionals should engage in active listening to understand concerns and needs, show empathy and understanding, which builds rapport and trust, use clear and concise language, avoiding medical jargon that may confuse non-professionals. Foster collaboration communication by involving parents, patients, and families in decision-making processes. Respect cultural differences and tailor communication to meet diverse needs. Effective skills in writing formal correspondence. Formal correspondence is integral to communicating information and ideas within the allied healthcare field. Effective skills include professional tone, maintaining a professional and respectful tone in all written communications. Use clear, structured with an introduction, body, and conclusion to organize information logically. Be precise and specific in conveying ideas and information. Thoroughly proofread correspondence to avoid errors that may undermine credibility. Tailor communication. Adapt style and content to suit the audience, whether patients, families, or fellow healthcare professionals. Understanding and addressing ethical issues and implications in research surrounding communication is vital for allied healthcare professionals. By adhering to principles of scientific communication, ensuring ethical conduct in human research, effectively managing communication issues, and demonstrating proficiency in both interpersonal and written communication, we uphold the highest standards of practice and contribute to the advancement of healthcare. Thank you for your attention. I look forward to any questions or discussions you may have on this topic. Thank you.